My name is Dr. Hari Iyer. I'm a hand and upper extremity surgeon, and I work at the Center for Hand and Upper Extremity Surgery. Arthritis is painful degeneration of a joint, and there are many different types of arthritis. You can have standard garden variety arthritis that we get as we get older. You can also have something called inflammatory arthritis. It's usually associated with things like rheumatoid disease, lupus, psoriatic arthritis. Those tend to be a little bit more destructive to the joints. They can often be very painful with lots of swelling as well. For things like rheumatoid arthritis, inflammatory arthritis, the joints involved tend to be a little different. You usually don't get pain in this joint or this joint, these two joints. You usually get pain across these joints down here. The other thing that you can get is you can actually get quite a bit of wrist pain and wrist degeneration. It's important to recognize these things because if you let them sit for too long without an intervention, it can lead to some significant debilitating deformity of the hands over time. And so oftentimes the role of the hand surgeon is to be able to intervene in a timely fashion in order to help reconstruct the hands and prevent further degeneration. For rheumatoid arthritis, for example, a lot of times you'll see patients who have fingers that are bent and kind of angled off to the side. What we do is we actually realign the tendons using surgery to help realign the fingers and bring them back to a more normal functional position. In some cases for inflammatory disease, the joint itself can actually become degenerated, much like arthritis. In those scenarios, we can actually do joint replacements. Joint replacements aren't just for hips and knees, we can actually do them for the small joints of the fingers. Recovery from surgeries like these might take up to 3 months. With the rehabilitation process, it could take up to 6 months, depending on the patient, depending on the type of surgery that we do. But it is a lengthy recovery process. But the nice thing is that we have great therapists and great surgeons that can help watch you along the way and help be part of the team.